Okay, sounds good. Good morning. I'd like to call the Health Services Committee for February to order. And the first thing on the agenda is a motion to approve the minutes of last month's meeting. Supervisor Hogan, seconded by Supervisor Bramer. Thank you. Any additions or corrections to the minutes? All right, not we'll vote then. All those in favor? Okay.
Aye.
Opposed? All right, carried. Thank you. And with that, Rob, I will turn it over to you. How are you this morning?
I'm good. Good morning, everyone. Okay, so I have a couple of resolution requests that I want to bring forward to the committee. First of all, resolution request to amend the 2022 Warren County budget to allow for acceptance and pass-through of 100% state aid from the New York State Office of Addiction Services and Supports. This funding in the amount of $41,250 has been allocated to 820 River Street by New York State Oasis to provide funds for jail-based addiction treatment or transition release services. These are services that help connect individuals as they're releasing from the jail with appropriate services and supports in the community. In October of this year, mandated MAT, which is medication assisted treatment, will be required in the county jails. And as part of that act or legislation, it requires these transition release services as well in the county jails. 820 River Street actually started providing these services during DSRIP with some DSRIP funding. And then when the DSRIP funding dried up, there was no funding available for these services. But now that we've been able to secure some funding, we would like to develop a new contract with them, which will be my next request, to pass through this funding of $41,250. I've talked with the sheriff and the sheriff's administrative team, and they're on board as well with this request.
Okay, thank you. Should we put 1 and 2 together then, Rob, as long as you, or do you want to do those two separately?
Fine by me, however the committee prefers.
Is it all right to put the two together? All right, would someone like to make that motion to put the two of those together? Supervisor McDevitt, seconded by Supervisor Conover. All right, any discussion? And thank you, Rob, for the explanation on that. We appreciate that. Supervisor Hogan?
Thank you. I wholeheartedly support these. I think this is great. Is this something that you think they're going to come up with funding year after year, or should we start looking for a more sustainable source of funding going down the road?
Well, that's actually an excellent point, is that right now there's funding included in the budget, New York State Oasis budget for this. If it were not to be reappropriated, we would probably look to sustain this with opioid settlement funds, or at least propose to do so. My understanding is that at least, I think there's different buckets or pots of the opioid settlement funds, and some of those funds there'll be like a sub-allocation for the local government units or the community services boards to allocate within the local service systems. So I think there's a certain level of funding that goes to the county that has some of it has restrictions and some doesn't, I think, unrestricted. But there's also a sub-allocation that'll be coming to our office and to the community services board. So we would look to definitely sustain this over time, yes.
Great. I'll look forward to seeing that
Okay,
get into your budget then. Thank you.
All right, all those in favor?
Aye.
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 Opposed? Carried. Thank you.
Wasn't sure if Supervisor Bramer was trying to ask a
Oh, I'm
question.
sorry, I didn't realize you had a question. Go ahead, Supervisor Bramer.
That's okay. Thank you, Chairwoman. Thanks, Rob. I was wondering if this is a change from the current jail-based services.
This is not a change. This is a continuation. Actually, we've been looking for the last couple of years for funding to sustain this.
Okay.
The agency has been providing this service. They call it the ABLE program, Access to Better Living Experiences. Again, it was something that was started during district when we had, funding coming at that time, and we've been searching the last few years to be able to sustain it.
To get the funding. Okay, thanks, Rob. Try to keep up with all this stuff.
I know, isn't that the truth? Okay, Rob.
Okay, then did we take care of number 2 as well? Is that 1 and 2?
1 and 2 together, Rob, yes.
Okay, I'll move on to number 3, a resolution request to amend the 2022 Warren County budget, again, to allow for acceptance and pass-through of one-time funding in the amount of $200,000, also from New York State OASIS. The Addictions Care Center of Albany is in the process of developing a men's residential rehabilitation stabilization program. They've purchased property on Quaker Road in Queensbury. They're in the process of doing renovations, and the project is well on its way, but due to probably really COVID-related reasons, they've run into increased expenses related to materials and labor, et cetera. And so they made an appeal to New York State OASIS for some additional funding, and they were awarded this one-time $200,000 to assist with renovation and startup expenses for the men's residential stabilization rehabilitation program.
Oh, terrific. All right, would someone like to make the motion to bring that to the floor, please? Supervisor Hogan, seconded by?
I'll second it.
All right, Supervisor Conover, thank you. Any questions? Supervisor Bramer?
Okay, thank you, Chairwoman. Rob, I think this is the one that I have concerns about, the loss of the residential program in Glens Falls. Can you give us an update on that and how that will overlap or transition with this coming online?
Yeah. So previously we had a men's residence that was operated by 820 River Street on Crandall Street in Glens Falls. That was also a men's residence. However, it was really what they call, at the time, it was the regulations were such that it was more or less like a halfway house. It was a step down from rehabilitation. So what happened in the past under the old regulations is that people with addiction issues would have to usually go out of the area, maybe Capital District area or somewhere, for detox, and then go into a rehabilitation program, which might even be a separate program. And then they would come back to their home communities in these residential programs like Crandall Street was. The New York State OASIS decided that that was creating barriers for people to have to move to those different facilities. So they changed the regulations so that more clinical services were being brought into the residences. And it's a different regulation actually that they're under now, the residential programs. And 820 River Street never did apply to become this more enhanced clinical residential type program, whereas the Addictions Care Center of Albany did apply for that. They opened the women's residence over in Queensbury as well, and are in the process of opening a men's residence. What it does is it allows people to go right into the facility, receive their detox, the rehabilitation services, and then the reintegration back into the community, all in one setting. So that's why Crandall Street really just sort of dropped off, because they didn't apply for the new, under the new regulations.
May I follow up just quickly? So they don't exist anymore at all. And
they have continued to provide the reintegration level, which is the lowest level of service, but it's not under these new regulations. It's still kind of under the old regulations, but they don't receive any funding from OASS for that.
Okay, thank you.
You're welcome. And thank you for all that information, Rob. That was good for us. All right, we have a motion and a second. All those in favor?
Aye.
Aye. Opposed? Carried. Thank you.
Okay, thank you. In terms of discussion items, just quickly, I wanted to hit on anything in the 22-23 New York State executive budget, proposed budget that, I thought might be of interest to the committee or impact to the county. And fortunately, really, for the most part, it seems like the proposed budget is advantageous to our system of services. Most of the state agencies, what's proposed would be some increased funding for workforce, which has been there's currently really a workforce crisis in our system. But they are proposing 5.4% COLA increases for the not-for-profit agencies that we contract with, and also funding for workforce with initiatives like retention bonuses, one-time sort of things, et cetera. There is also going to be this year, sort of mid-year, July, implementation nationwide of 988, which is an alternative to 911. It will divert some of the mental health crisis calls, and those calls will go directly to call centers located throughout the state that actually are the existing call centers that answer the 1-800-273-TALK. That's the National Suicide Crisis Hotline. And they're switching that over, doing away with that longer number and just implementing a 988. And so you may be seeing some promotion of that, but there's proposed funding in the budget to help implement 988. And they're also looking to increase call centers in New York State. So there's even currently out an RFP for that. Just in terms of our Dwyer Veterans Peer-to-Peer, people are familiar with that program. Previously was not statewide. Not all counties have a Dwyer program. The governor has proposed to make that statewide, so there's funding in there for the counties that did not have that program, and continued funding for our counties and others. There's proposals for residential rate increases for our some of our mental health residential providers. As I mentioned, the jail-based funding from OASS for services and transition services in the jails. And then the big issue, I think, that's been part of our discussions over the years is the Criminal Procedure Law 730. There's some proposals to reform some of that language in criminal procedure law. Unfortunately, I don't see anything in there that talks about proposing that for the state to resume paying half of the expenses. If you recall, within the last 2 years, it used to be 50-50 that counties paid half and the state paid half of the restoration expenses. And I don't see any, they changed that to make it 100% county expense. And I don't see anything in here to reverse that, unfortunately. I know that NISAC has been very involved in advocating for some CPL 730 reforms. But I don't see what I would look for in there would be that switch that the county would resume paying, or the state would resume paying their half of their share. So that was really it in terms of what I saw in terms of impacts to the county in the executive budget. Also, just want to provide an update on the Adirondack Peer-to-Peer Rfp. We had gone out to an RFP. This is a joint program with Washington County. We've established a selection committee, and we've been organizing dates and such for that committee to gather. We are going to gather on March the 1st. We have Supervisor Driscoll, Supervisor Frazier. From Warren County, we have Supervisor Sue Clary from Washington County. And then we have our Veterans Directors, Service Agency Directors, Denise DeRista from Warren County and Ken Wenchel from Washington. There's a couple of members from our Community Services Board, Cindy Wasson and Amy Malloy, and myself. And we'll be getting together, reviewing those proposals, and hopefully within fairly short order, coming back through committee and to the full boards with recommendation for award. Just to remind folks, we did have 3 responses to the RFP: the Adirondack Vets House, SUNY Adirondack, and an agency that's called People USA. So I'll be bringing more information back to committee as that group advances their work.
Okay, Rob, thank you for the update on all those important issues. We appreciate that. You have anything else, Rob?
That's all.
All right, any committee member have anything they want to ask Rob? All right, if not, then Rob, we'll see you next month, and thank you again.
Very good. Thank you.
Mhm.
She's on.
Okay, Dee, you're there?
Yes, I am.
Okay, we're ready to begin if you are. How are you this morning?
Good. How is everyone?
We're doing okay, thank you. Snow and all.
Beautiful day out there, isn't it?
Oh, yes. Okay.
So the first item on our agenda is permission to amend the contract with our dietitian to increase the hourly rate from $45 to $45.
You mean 40 to 45, right?
All
40.
right, yes.
Okay, good. All right, go ahead.
All right, so the dietitian has not had an increase in over 9 years. There will be no impact on our budget as the do not exceed amount will remain the same.
All right, so would someone like to make that motion to approve that? Supervisor McDevitt, seconded by Supervisor Hogan. Any discussion on that? All right, let's vote on it. All those in favor?
Aye.
Aye. Opposed? All right, carried. Thank you.
The second item is permission to delete our typist position, grade 3, salary of $30,373 due to resignation, and create a services assistant OFA number 4, grade 7, salary of $36,414. I did discuss this with the staff here in the office as well as civil service. And looking at the tasks that we needed to be completed within the office, we felt that this was a better fit. It allowed more flexibility and continuity of services for our clients. Due to the number of years that the person in the position had previously, we do not feel it will have an impact on our budget. But if it does, we will utilize stimulus funds to cover any excess amount.
All right, good. Thank you. Would someone like to make that motion? Yes, Supervisor Geraci, a second to that motion. Supervisor Conover, any discussion? Anyone have any questions? All right, all those in favor?
Aye.
Aye. Opposed? Carried. Thank you.
The next item is permission to fill that position.
All right, someone like to make that motion?
I'll make it.
Okay, Supervisor Conover, seconded by Supervisor McDevitt. All right, all those in favor?
Aye.
Aye. Opposed? Carried. Thank you. Number 4D.
We would like permission to fill our meal site cook number 7 at the Long Lake meal site. This is a grade 2, 25 hours a week salary of $18,584 due to resignation. The person that was in this position started the job in October of 2021, and unfortunately she just did not like it. It wasn't a good fit. This position is 100% reimbursable because it is a Hamilton County position.
All right, thank you. Would someone like to make that motion to approve that? Supervisor Hogan, seconded by
I'll second it.
Supervisor Beatty. Any discussion? All right, all those in favor?
Aye.
Opposed? All right, carried. Thank you. Number 5.
We would like permission to enter into a contract with RSVP, that's Retired Services for Volunteer Program. It's with the Tri-County United Way, to provide medical transportation to residents of Warren County in an amount not to exceed $5,000 per year. We will reimburse them for each trip, $20 for each trip that is less than 25 miles, and then $35 for each trip that is between 26 and 50 miles. We would also like the option to renew for annual renewals if there's no changes. This will help us meet the transportation needs of our seniors in Warren County, and it is 70% reimbursable by the New York State Office for the Aging.
All right, someone like to make that motion? Supervisor Hogan, seconded by Supervisor Conover. Gosh, off guard. Okay. Question, Supervisor Hogan?
Thank you. Hi, Dee. Can you hear me okay?
Yes.
Yes.
Thank you. In the past, this service was not available to residents in certain towns throughout the county. I've spoken directly with our SVP about this in the past, but I haven't had the opportunity to talk to the United Way recently. Have you had that conversation? Do you know what the scope of these services is and where they're willing to go?
Unfortunately, they're only able to do it for residents within a certain mile radius of Glens Falls and Queensbury, so it would not encompass residents of Johnsburg, Bolton, Lake Luzerne. But we do have our own medical transportation program where we do it and then we reimburse our volunteers mileage. It has not been available since the pandemic started, but we are hoping to get it started again very soon.
Okay, well, I'm really happy to hear that the county is filling the hole, but I think in the future, when we bring this resolution to the committee, I'd like to see it acknowledged that it is not a whole county initiative.
All right, I think we can do that. All right. Did I get a motion on that yet? You did. Got a motion. Okay. Any other questions? All right, all those in favor?
Aye.
Aye. Opposed? Carried. Thank you. Discussion items, Dee.
I actually have one more item, and I'm not sure whether or not it would be a resolution that would come from my committee or another one.
Okay.
To prevent certain supervisors from getting upset. I'm not going to go into details, but if anybody would like an explanation, I can give that. While I do believe that I deserve the 5-year step increment that I received as my increase this past year, I am asking that the $2,028 that I received be divided up equally between the Director of Public Health and the Assistant Director of Public Health. Because I've already received a portion of this, once the change takes place, I will either write a check out to the county for the amount that I've already been paid, or ask that it be deducted from my next paycheck. Because there is no revenue associated with my increase, I do not foresee any reason why this cannot be done as a transfer of funds from OFA to Public Health and an adjustment to the salary schedule. This would also not have any impact on the budget. The only stipulations I would like added are that the Director of Public Health and Assistant Director of Public Health cannot refuse this, and I know they will try. If one of the above leaves county employment within the year, the remainder of their share of the increase be transferred to the other, and the full amount of $1,014 be included for all future years of the other person's employment. If both of the above leave county employed within the year, the remainder of their share of the increases be transferred back into my salary, and the full amount of the increase of $2,028 be included for all future years of my employment. For the past year and a half, while the rest of us have been able to go home at the end of our shift, these two individuals have been putting in 14 to 16 plus hours a day. While the rest of us have worked a 5-day work week, these two individuals have been working 7. While the rest of us have been able to spend time with our families and relax on holidays, these two individuals have been working, taking calls, checking on Warren County residents, etc. While the rest of us were able to take our vacation, personal, and floating holiday time, these two individuals could not. Yes, they did finally get paid out for their unused time from 2020 and 2021, but unfortunately, when our former leadership was given the opportunity to recognize all of the extra time energy, and work that they put in these past 2 years, it fell short. They did receive the highest merit increases that were supposed to be available.
Can
But there
can
were
I
others that
interrupt Dee?
Excuse, no, let her just finish, please,
I
Supervisor.
think we need to do this in executive session.
I'm not discussing the performance, work performance of somebody.
No, all she's discussing is what she wants to do to kind of repay these two for all that they did.
But I think we did cross into work performance.
Yes,
Yes, we did. I
Executive
asked
order.
for a motion to go into executive session.
Okay, Supervisor Beatty wants to go into executive session. A second to that motion. Supervisor Hogan.
I
All
would
right.
request that Janelle be allowed to come to this executive session,
Sure.
I don't have a problem with that at all.
and Pat as well.
Wait,
If I may,
Go
just
ahead.
as a point of order, Supervisor Beatty, can I amend your motion so that the purpose for going into executive session is to deal with matters leading to, well, actually, it would be matters, I'm trying to determine the basis for executive session. I do not believe it's matters leading to the appointment, employment, promotion, demotion, discipline, suspension, dismissal, or removal of a particular person. But it may be for the committee's consideration involving the financial or employment history of a particular person, but I'm not clear from what Parks has already stated in open meeting that it is under that basis. So
Madam Chair?
I'm just trying to help the committee come to a proper legal basis to go into executive session.
yes, Dee, go ahead.
Okay, I basically have just 3 more sentences. They did not receive the highest merit increases that were supposed to be available, but there were others that received more than that, and I'm not sure why or how. Janelle and Pat, you've led the public health team during a horrible time. Your dedication to the residents of Warren County, your compassion, kindness, and willingness to give everything you had to take care of us did not go unnoticed. Thank you, and I'm sorry I couldn't do more.
All right, so that's the end of what you have to say, then. Do we still feel that?
About that, yes, it is.
There's still a motion from the supervisor from Queensberry to go into executive session. I'm not sure if he wants to proceed with that or if he will withdraw
I'll
that.
withdraw that, Madam Chairman.
All right, thank you, Supervisor Beatty. And
You're welcome.
Supervisor Hogan, you seconded that?
I
Yeah.
do, but I'm very uncomfortable. We're in a gray area here.
Okay.
Yeah. Madam Chairwoman?
Listening to the attorney, so I guess I'm going to listen to what he has to say, because I certainly don't know what the answer to. Supervisor Conover?
Yeah, there's no actionable item in front of us. I recommend we move on to the next item on the agenda. Thank you.
All right, thank you. So how do we proceed with that? Just accept what Dee is offering? Can we do that as a committee?
No, the question in deference to the supervisor from Bolton, there's no motion before the committee today, and there's no resolution request before the committee today.
So we can just move on to the next item. If that's what
And
you're
again,
saying?
I'm not the parliamentarian, but my understanding would be that the committee can move forward with their agenda.
Okay, so that's what we will do then. We will move forward. Did you have anything else on there? No, I think you did not.
I did have the discussion item,
Right?
was just to let you know that I requested permission to attend the Association on Aging Leadership Institute from April 5th to 7th in
Mhm,
the amount of $187, and that was approved.
right.
And then there was a referral or pending item, which was request that I prepare a plan to address staffing issues at meal sites to present for a review at a future committee meeting. I believe that this has been addressed. If you guys would like to keep it on there for a pending item, we can.
All right, well, maybe we should leave it on there because I know we still have supervisors who are very concerned about the 5 days a week. But I know you're having a very serious problem with volunteers, so you can only do what you can do if you don't have the staff to work with. So, but we'll leave it on there, Dee, if that's all right with you.
Okay.
Okay, thank you. Anything else?
No, thank you.
Thank you. Any committee member have a question for Dee, or are we good? We're all set? Supervisor Hogan.
Hogan has-
Hi,
Pardon?
I have, thank you, Chairwoman. I have two things. One, I'll make a motion to accept the minutes from the last meeting.
Oh, thank you. You mean I forgot to do that?
No, we did it at the very beginning.
She said she has Hogan and Bramer who did it at the beginning.
Okay.
Okay.
And second, Dee, while we have you here, I understand what the issues are, but do we have a plan for getting back to 5-day meal delivery?
As I've mentioned a number of times and just recently last week to you, we are still in need of volunteers for our Glens Falls and our Queensberry site. We also still need a driver for our Lake George route so that we can deliver to them on Mondays, Wednesdays, and Fridays because they are still receiving mom's meal.
I
We
do
are
understand
trying,
that,
but
but at some point, will we be able to move beyond, some of these staffing issues to at least get back to 5 days in the communities that have the capacity?
Not a staffing issue, it's a need for volunteers, and yes, we are trying. But I cannot pull volunteers out. We need people to volunteer. We're actively trying to get volunteers. We have been since September of last year, but I can't pull them out of thin air. And I've asked numerous times for assistance.
I very much get that, and I've been trying to do everything I can to help you find volunteers, and I know that other supervisors have as well, but that really wasn't my question. My question was, at some point, will we be separating the consideration for the communities that do not have the volunteers from the consideration for the communities that do have the volunteers?
We have discussed that previously as well, and I think everyone was in agreement that we should be doing it as a whole. Shouldn't be separating one community from another.
I think I'd
That
like
wasn't
to.
fair.
I think I'd like to see that as a discussion item down the road after people have had time to think about that, and because I can only speak from my own perspective, but the community up here is really anxious to get back to 5-day-a-week meal delivery, and it's very, very hard to explain to them why we can't. So I think I'd like to see us continue to discuss this.
Well, it's still under pending items. I just had said to Dee that we will leave it there, so we'll see if we come up with anything different by next month. I know she's trying very hard, but you can't kind of pull volunteers out there. And I think even the people who get the meals kind of have to be understanding of that you can do only so much, and they're going to have to be patient. I don't know what else to tell you on that. So,
well, where they're losing their patience is simply in the fact that, in certain communities around the county, the volunteers are sitting ready, waiting and willing to provide this service. We get there's an equity issue. We're all working on it, but it's very hard to tell my community members that, we have to wait because Glens Falls doesn't have enough volunteers. They're having a hard time continuing to understand that.
all right, thank you. Then we'll take that into consideration. Anyone else have anything else for Dee? If not, then I think we're good with this, and we'll see you next month, Dee. And thank you.
Thank you.
Yes, sir.
There should be a motion to adjourn and then request for discussion.
No, because I have one more committee thing.
I'm sorry.
Right, no, that's all right. All right, thank you, Dee. So we will move on to public health. Are you there, Janelle? There you are. Okay, we're good to go.
Good morning, everybody. Should be pretty quick today. My first resolution request is to request that we adopt the 2022 to 2026 rabies plan, which was attached electronically. Warren County is required to have a rabies plan to address the prevention and control of rabies. The most recent plan was 2016 to 2020, which continued to be utilized through 2021 due to the pandemic. This plan's been recently updated and we're requesting approval.
That's a very lengthy plan though, isn't it, Janelle? It was like, oh my goodness. This is the rabies plan. It was umpteen pages. All right, would someone like to make that motion to adopt the rabies plan? Supervisor McDevitt, seconded by Supervisor Hogan. Any discussion? All right, all those in favor?
Aye.
Aye. Opposed? Carried. Thank you.
For the second resolution request, it's to amend the 2022 budget to reflect the additional allocation with the ELC COVID enhanced detection, which we call ComCare contract, which is the contract number 6347-01. This is your attachment 2, and I'll turn the floor over to Ton to discuss.
This was just to let everyone know that we were given $321,989. And I had amended the budget in January for $314,492. So just the difference of $7,497 needs to be added to both revenue and expenses. So that's what this attachment is.
All right, so we need a motion on that one then, correct?
Yes.
All right,
Yes.
someone like to make that motion? You need the motion to amend the budget. Supervisor McDevitt. All right, a second to that? Supervisor Geraci. Any discussion? All right, all those in favor?
Aye.
Aye. Opposed? Carried. Thank you.
Attached, we have our regular attachments. The 2021 books aren't closed, so if there's any questions with our financials, we're happy to entertain that. In addition to any questions on our other attachments that we have.
Anyone have any questions?
No.
No? All right. then
All
I
right,
guess-
and then finally, under meetings and conference authorizations, in the last month, we've made 3 requests, even though it's only 2 noted here. The first is Jody Brines, our supervising public health nurse, will be virtually participating in a home care association sponsored meeting that includes 4 sessions. It's called Oasis E-Prep Building Blocks for Success. The dates are included on the agenda. The cost of the training was $260, which is in our budget. And that's attachment 8. Attachment 9 is for 2 of our WIC employees, Beth Paquette and Jolie Navatka, to virtually participate in the New York State sponsored training, New York State Breastfeeding Coalition Conference. And that training is recommended by WIC as well. We were able to get in the early bird registration fee of $95 per participant for a total of $190. This is also included in our WIC budget and covered by our grant funding.
All right, good.
And with that, that's all I have.
Oh, you weren't kidding when you said it would be brief, were you? Does any committee member have anything to ask of Janelle or need anything further explained? All right, if not, then I'm going to ask for a motion to adjourn. Supervisor Conover, seconded by Supervisor Geraci, but now it's time for discussion. If anybody has anything they wish to discuss before we formally adjourn. Nothing? So all in favor of adjournment?